Efficiency's webinar on smart water management for ensuring safety and efficiency in building water systems. We're very pleased to offer you this webinar today on a free of charge basis. This is an issue that's very important to us and that we wanted to make sure was instructive for water conservation professionals and those who are involved in building water management. The webinar itself will be 60 minutes in length, and that leaves plenty of time for questions. The audio for the webinar is through your telephone or computer microphone and speakers. So if you're hearing my voice, you've figured it out. If you haven't, hopefully this narrative on the slide will help you understand how to connect up to the telephone. It's in the original message that was sent by GoToWebinar along with the password. We will be muting the phone line because we are recording this webinar, so the entire presentation will have all of you on mute, although the speakers will be able to be heard. This minimizes the background noise and ensures a very clean recording. We are posting this recording and we'd like to make it available so that as we do more webinars in this topic and create a series, you'll always be able to go back to the original introductory one and listen to it. We'd love to have you participate. Questions for the webinar can be typed in through the webinar chat box, which you can access in your upper right-hand corner of your computer screen. Look for a little orange box with a white arrow. If you click that box, it opens up the dialog screen for the webinar, and you can type in your questions there, and they'll come through to Jeffrey, who will assemble them and read them out to the speakers. So although we have you muted and you can't actually speak with us, we are hoping you will speak with us through the webinar dialog box and that you'll give us your comments and or questions as we move forward during the webinar. You can type them in throughout the entire webinar. You don't have to wait until the end. So we're very pleased today to have some great speakers to talk to you about this topic. We have Dr. William McCoy, who's the Chief Technology Officer and co-founder of Phygenics Ltd. And we also have Denise Hickey, who is the Public Relations and Water Conservation Manager for the North Texas Municipal Water District, who will give us a perspective on this issue at her water utility. What we'd like to try and achieve today in the webinar is to address this emerging issue of water aging and the loss of disinfection residual and subsequent pathogen growth that we see occurring in water utility systems and also in building systems. Because we'd like to make sure our water conservation practitioners understand what is occurring and understand what may be blamed as water efficiency for the reason for this occurrence. So we'd like to make sure that everyone has some information about what really is happening. In that respect, we'd like to give you a basic introduction to the best practices for ensuring safety and efficiency in building, plumbing, and water systems, and so we'll be introducing that. We'd also like to give you an example of a utility experience with a disinfection problem and how they handled it at the North Texas Municipal Water District. And then lastly, we will talk a little bit about providing guidance on managing messages to your consumers about this issue. And in subsequent webinars, we'll talk about this in a lot more detail, but we're introducing that concept here. It's important that water conservation managers communicate with their customers where this issue is cropping up in your service area. So at this point, I'd like to turn it over to Dr. William McCoy, who will begin the discussion of this issue.
Thank you, Marianne. Good morning to everyone. Good afternoon if you're in the Eastern time zone. Thank you for joining us. We begin today with a discussion about the water supply that comes to our buildings. Generally, in the United States, the quality of the water that we receive in our buildings is very high. It's treated to the National Primary Drinking Water Standard. The municipalities do an excellent job and provide great quality water, and that's true in most of the developed world. However, a lot of variability can affect the quality of the water. And as you can see on the slide, some of those variabilities can occur due to the age and condition of utility distribution system centers. The seasonality is a major effect. From season to season in the year, the organic loading in the water can vary quite a lot. And then there are periodic events that occur, main breakage, some repair, and so on, flushing the hydrants. There are periodic events that can affect the quality of the water. Now, among those issues, perhaps one of the most significant is what now we call water aging. And that refers, of course, to the retention time of water in the system. This is documented. There's no question about water aging as an important phenomenon. Water aging relates to the distribution of the water from the municipality, but also it refers to the retention of water in the building when the water crosses the meter into the building. So this factor, along with many other quality issues, have prompted end users to begin monitoring water quality in real time. For example, the Veterans Health Administration just this summer published a directive 1061 which requires monitoring the water quality that enters into all the VHA hospital facilities, all the healthcare facilities. And there's a requirement to manage the quality of the water in the building. Now here I'd like to make a very important point. While the water that crosses the meter and enters into the building is generally of very high quality, when that water enters into the building, many processing steps occur. That is to say, the facility management, the managers, the people who are running the building, the facility engineers, the users are manipulating the water in various ways. And these processing steps can and often do affect the quality of the water. The processing steps I'm referring to are storing the water, heating the water, cooling it, conditioning it, filtering it, distributing it, regulating its pressure, and so on. Now, if the water quality degrades sufficiently, it can become hazardous. If a building manager chooses to add supplemental chlorine or any other disinfectant, then they are really subject to the Safe Drinking Water Act, which is a federal law and regulates all public water systems. So, for example, a hospital is a non-transient, non-community public water system. No question about it. And according to federal law, it's a consecutive system unless they treat unless the hospital chooses to treat the water. If so, then they become a regulated public water system. So I mention this to just encourage you, if you are contemplating a chemical treatment of the drinking water in your facility, be aware that there's a federal law that regulates you as a public water system. Facility managers are now engaging more with municipalities for this reason and other reasons related to water quality, just to ensure safe and efficient use of water in their facilities. Now, what I'd like to do now is give you an example, really. In the next slide, you'll see, I think, Marianne, let's advance to the next slide. I'd just like to give you an example of an experience that connected those who are working on efficiency issues and sustainability issues with those who had to deal with the safety issues. And really, this example is an illustration of why we're giving the webinar today. The need is to coordinate sustainability and efficiency issues with safety concerns. So look at this example, a LEED Gold building There were point collecting technologies involving reclaimed water, low flow urinals and faucets, and processes combined with reduced tenant use, 50% capacity in this building. And this resulted in stagnated water. The water age in the facility was much higher than anticipated. Now, the city was providing 0.5 parts per million free residual oxidant as chlorine, but it was quickly consumed due to the stagnant water. And of course, in that situation, we know that bacteria and other microorganisms could proliferate because there wasn't enough disinfectant. And this resulted in increased microbiological hazards in human health and safety risks, specifically due to the presence of Legionella bacteria. Now, if you go to this next slide, I've listed some of the solutions that the facility managers put in place to deal with the safety hazard. So the implemented hazard controls were weekly tap flushes, which consumed up to 3,000 additional gallons of water. Bottled water had to be used for certain applications. Hyperchlorinations of the system were required. Installation of a secondary disinfection unit. And then the employees were not allowed to use the showers, so they didn't feel comfortable riding bikes to work, which was one of the reasons why they put the showers in. It was perhaps one of the main reasons they put the showers in the first place. So here's the message. If we don't coordinate our use of the building and efficient use of the building with safety considerations, then we lose the opportunity to keep these gains and to make the sustainability efforts really come to fruition. We'll talk more about that as we go on. But what I'd like to do now for the next few minutes is give you some detail about what the safety hazards are in buildings, especially as they relate to this water aging factor we've discussed and loss of disinfectant. So the first thing I'd like to point out is that when hazardous conditions get out of control, outbreaks can occur. And an outbreak of disease associated with a building water system is very serious. An outbreak refers to more than one disease case associated with the building. The Centers for Disease Control and Prevention in Atlanta, Georgia, it investigates all outbreaks of Legionellosis associated with building water systems. And after about 30 years of experience doing this, here's what they say are conditions common to outbreaks. They are lack of familiarity with how water is processed in the building. And I referred to that at the very beginning of our talk when I was telling you about the variability that occurs. Lack of effective microbiological controls, and this often occurs especially if water is not moving rapidly enough, if not turning over, if the water age is excessive, the disinfectant dissipates. And then third, lack of coordinated prevention efforts. And what this means is lack of communication. The people in the facility are not aware of the problem, nor are they coordinating prevention efforts. This is why disease and injury does occur, and fairly often, actually, as you'll see in the next slide. I want to show you that this is a significant problem. And here's a kind of, I'll call it a cartoon to illustrate what happens. It's a diagrammatic representation of what happens on the surface of the water system pipe. And you can see that on the graphic. Especially if there's no disinfectant or low disinfectant in the water, biofilms develop on the surface of the pipe, and they are comprised of many kinds of microorganisms, and we've symbolized that with all these little circles and rod-shaped structures. Those are bacteria that are growing on the wall of the pipe. Now, other microorganisms feed on those biofilms. They graze on the biofilms, like sheep grazing on the grass, so to speak. That's not a perfect metaphor, but it's close. So the higher life forms, the protists, and those are the protozoa and the amoeba and other life forms, are grazing on the bacteria, eating them. However, certain bacteria, among them Legionella, are not consumed by the protist hosts, the protozoa, but rather they infect the protozoa and grow inside of the protozoa. They take over the host cell, and then they're released on lysis back into the water flow, and then can infect more protozoa. This is called amplification and can result in massive numbers of pathogenic bacteria. Now, how does that relate to disease? Well, if the water is inhaled into the lungs, the Legionella can infect, and they do infect, the white blood cells in our lungs, the macrophage. The alveolar macrophage, the white blood cells in your lungs, are infected by the Legionella, and they will grow inside those white blood cells and cause pneumonia. Now, it's not just Legionella that we're concerned with in building water systems. Down at the bottom of the slide, I've listed the other genera that are extraordinarily important, causing as much building-associated disease as Legionella, but not as well known. In the United States, the only reportable disease from this group of pathogens is Legionella. But all of these other microorganisms, Pseudomonas, Stenotrophomonas, Acinetobacter, Elizabethinia, Mycobacterium, Alkaligenes, and Aspergillus, which is a fungus, are all associated with building water systems and cause significant disease in the United States. And it's all because the water in the facility degrades in quality and leads to hazardous conditions. Well, how much disease are we talking about? Let's just look at it, a few numbers, a little bit of statistics. I'm just going to talk to you really about the Legionella pathogen and the resulting disease, which we generally call Legionnaire's disease. In the United States, according to OSHA, 4,000 deaths occur every year associated with building water systems. Every one of those disease cases is preventable. You know, you might not realize this, but that is more mortality, that's more death than is caused by food poisoning in the United States. And this is, of course, an astonishing fact that there's more disease and, lethal disease caused by Legionella associated with building water systems than there is from death caused by food poisoning in the United States. The cost is huge. Setting aside the cost of human suffering and just looking at the dollar amounts, we see really a staggering dollar cost to this. Every hospitalization for legionellosis in the United States, average cost is $34,000. And just the direct health care costs are in the hundreds of millions of dollars. But then there's the indirect costs due to lost productivity, absenteeism, and disability. You can add $12 for every direct health care dollar. So take the direct health care cost, and multiply by 12 to get an estimate of the total cost of healthcare. It's in the billions. And then the last item here we must always remember, and that is the cost due to litigation. More and more often we see disease cases resulting from mismanaged building water systems, resulting in lawsuits. And there are eye-popping numbers associated with these lawsuits. The one that I've mentioned on this slide has to do with a $193 million jury award. But I could also reference to you right now, there's a case pending, $300 million class action lawsuit, 8 cases of legionellosis, 1 building water system, and that case is pending. The insurance folks are now getting much more involved in figuring out how to handle this. The general public is becoming much more informed. So this is really a very serious issue in terms of monetary value. But the real cost here has to do with the human suffering involved. Because remember, for every one of these victims, really, of a building-associated infection, there are dozens of people who are injured, the people in the family, the employers, the people in the community who have to deal with the injury and disease. When you add all that up and then consider carefully that these disease cases and injury cases are all preventable through proper building water management, we really have a huge motive to get this problem solved. So what I'd like to do now for just the next few minutes is talk to you about how to solve this problem. The good news is we can prevent these cases. The Centers for Disease Control and Prevention recommends to all facility managers in Legionellosis outbreaks that they should develop HACCP-based water management programs for ongoing hazard analysis and control to prevent further disease cases. Since 2000, the CDC has advised facility managers involved in Legionellosis outbreaks to apply HACCP principles to the management of their building water systems. And since 2000, there's not been a reoccurrence in any facility that has followed this recommendation. So this is the reactive solution. This is how to prevent further cases. But the further good news is application of these principles is also effective for preventing any cases, because we don't want any outbreaks. And the way to prevent the outbreaks is to manage the system to these quality principles. And I'm just going to take a few minutes to kind of quickly go through an explanation of HACCP. But what I'll do is refer to you that in 2015, Mary Ann and her associates and myself, we will put together a program, a webinar on HACCP, so we can get into the details of that quality process a little bit in more detail, where we won't do that today. Instead, what I'll do is just generally describe to you that the principles of hazard analysis and critical control point quality management is a process to develop a defensible water management program. And we want this word on the slide on purpose, defensible water management program. We want a program based on scientific principles that can then be used to make defensible decisions about how to prevent disease and injury. And the first step, really, and the most important part of the process is establishing a team. So we just made a little cartoon here to show that it's a team with the functions indicated on the bottom of the slide as members of the team that are communicating and that are working together to bridge the gap between efficiency issues and safety issues. So the team is really important. Let me just quick show you the 7 principles of HACCP. Again, we're not going to get into the details today, but this is kind of maybe a teaser, because we'd like to encourage you to join us next time, and we'll show you more about the details here. Notice that logo down at the bottom, NSF. That's the NSF International, non-for-profit organization that does standards for drinking water, and they have developed an education course, HACCP for Building Water Systems, which is available now and will become, there'll be many courses running in 2015. Here are the principles. Number 1, a hazard analysis is performed. The critical control points, these are the locations where hazard control must be applied to prevent disease and injury, are identified. Critical limits are established. The monitoring plan is developed. A corrective action specification for each critical control point is developed. Procedures to document, and then lastly, perhaps the most important part of the process, validation, which is evidence that the program is working, and verification, which is confirmation that the program is actually being implemented. These 2, validation and verification, are key principles. And then, of course, reassessment to make sure that the plan continues to work. This is HACCP, and it is the process that prevents more disease and injury from environmental source disease like food poisoning and water system poisoning. By far more disease than any other quality process for environmental source disease prevention. Okay, just a couple more slides, and then we'll move on. I do want to reference this article, which was published this year in Infection Control and Hospital Epidemiology. If you want to see how the system is applied to a real facility in healthcare, check this out. It doesn't, the Mayo Clinic is the top brand, really, in healthcare. In fact, they were recently rated the #1 hospital group in the United States, first class in every way. And they have applied the HACCP principles to develop their comprehensive water management program for the multi-campus healthcare facilities in Minnesota. And you can read about that in this publication. I encourage you to do that. Now, there's a direct correlation in the next slide between efficient operation and performance. Now, again, we'll get into the more details of this in subsequent webinars, but rather than look at all these numbers, listen to this. We know from lots of experience that systems which are run efficiently are often the safest, and systems that are run in a uncontrolled or poorly controlled way, those systems are both costly and unsafe. There's a correlation. And that, of course, gives us great motive to do what's indicated in the next slide, and that is bridge the gap. Bridging the gap between efficiency, safety, sustainability, hazardous conditions, bridging the gap. And that is really what must be done to improve the situation. And I'm here to tell you that we should be very optimistic and encouraged, because there are 3 separate communities working on this. In the area of water safety, we have the CDC, World Health Organization, NSF International. Water conservation, you can see these acronyms. These groups as well. And ASHRAE is developing standards and codes that would address both safety and efficiency. And the message here is that we really need to work together to optimize building water efficiency. In April 8th and 9th, actually, in Las Vegas at the MGM Grand, in the next slide, there will be a Smart Water Summit, which will give an opportunity for leaders in both sustainability and safety to coordinate, to bridge this gap that I've been talking about for the last 20 minutes. And this slide just is an illustration of what was done last year at the summit, which was at the National Academy of Sciences in Washington, D.C. The example that I just grabbed here is we had Don Mosley, who's the sustainability manager for Walmart. He spoke at the summit, but we also had David Cord, who's very much involved in the safety aspects of building water systems in the VA. And so these 2 perspectives, sustainability and safety, really must be considered when we manage our building water systems, because, and this is my last slide, and then I'll turn it back over to Mary Ann, this last sort of phrase I use everywhere I go and to whomever I talk to about building water management. If it's not safe, then it's not sustainable. And I think maybe if we keep that in mind, it will really help us bridge this very important gap between efficiency and hazardous conditions in our building water systems. Mary Ann, back to you.
Thank you very much, Dr. McCoy. This was a terrific presentation. And what we're trying to get at with this is to educate those of us in water conservation who weren't really accustomed to thinking about the water quality issues when we were designing our efficiency strategies for buildings. And as this issue is I don't want to use the word erupting, but I guess it kind of is, as we're seeing more and more incidents of places where the safety concerns are not also part of the sustainability and efficiency design, we run into trouble. So what we want to do is get you thinking about this and get you prepared for it, because these issues will hit you in your water utility. And in that regard, we wanted to invite Denise Hickey from the North Texas Municipal Water District to talk with you about how their maintenance of chlorine residuals affected their drought strategies. And while, again, we aren't accustomed to thinking that there's an intersection between water quality and conservation, Denise will explain, well, yes, there is. So I'll turn it over to you, Denise.
Thank you, Marianne, and thank you, Bill, for communicating with all of us on the webinar today the critical importance of maintaining our water quality and to ensure that it's safe for all of our end users to use, throughout our water systems, our distribution system, and our building systems. Again, thank you everyone for joining our webinar, and I'm going to speak today on how the North Texas Municipal Water Districts, what their engagement has been with the cities that we serve and the actions that we have been taking to maintain our chlorine residuals during drought. I needed to set the stage to give you a little bit of understanding of our situation here with drought. And who we are. We are one of the large water providers in the North Texas area. We serve water to over 1.6 million people. We are a wholesale water provider. Our service area that on the map that you see here is in that lime green shaded area. Dallas Water Utilities is in the more purple, Tarrant Regional in the blue, and then Upper Trinity in the hatched area. But we encompass about 9 different counties. We provide the treated water to the cities we serve, and then they basically, if you will, take ownership of the water throughout into their distribution system to the end users. The North Texas area, as much of the other parts of the state, have been undergoing extreme drought conditions. We're a little bit unique in that we also have water rights from Lake Texoma. In 2009, the zebra mussels, an invasive species, established inhabitants in Lake Texoma, and there was also a realignment of the state line, which ultimately bisected our pump station. So now we have pumps in Oklahoma and 1 pump in Texas. So since 2009, we had been denied access to 28% of our total supply. We were able to get that supply back online just this past May, but 28% of your supply immediately taken off the table. You can see from the slide that Lake Jim Chapman, one of our other water sources, has been in drought for over 4 years, the new drought of record for Lake Jim Chapman. And our main source of water, where all of our additional supplies are transferred to and, if you will, stored for our treatment plant to remove, Lavon has been in a 2-year drought. So needless to say, all of our water supplies have been stressed, with the lack of 28% of your supply and ongoing drought conditions. Okay, Marianne, next slide. This just gives you a timeline of the district's implementation of our drought plan stage. We currently have 4 stages to our plan, the effective date for those stages, and then what the outdoor watering parameters are for each of those stages. And in each stage, we have a goal reduction for our cities to achieve or exceed. Stage 1 is a 2% reduction. Stage 2, a 5% reduction with twice per week watering. Moving down the time frame as drought continued, you can see that we began our plan in 2011 and we continue in our drought plan today. We actually have built into our strategies is what we call seasonal watering. It's the non-growing period for our landscapes. So we further reduce the restrictions during the months between November and March. Not knowing what the summer was going to hold for us in regards to weather, we were anticipating something similar to 2011, where we had the highest temperatures for record number of days, highest max demands. It broke all records for 2011. We extended our seasonal watering through the summer, which was once every 2 weeks. We extended that through this past summer. Next slide. And we also, in regards to responding to drought, we have to maintain, as Bill had discussed, water quality, that chlorine residual, to maintain that safe water for use. The district does implement a common strategy that is recommended by the state of Texas, is that you conduct a free chlorine maintenance. Our chlorine residual is in the form of a chlorine and an ammonia molecule, chloramine, so that the chlorine will have a longer lasting effect out in the distribution system. So for about a month period during typically around January and February, we revert back to free chlorine in the distribution system. This is considered a water conservation measure in that it helps, if you will, clean out the distribution system so our cities won't have to, or they will reduce the amount of flushing that they will have to do during our hot summer months. We do make notification to our member cities, the media, and the public. But what we have learned is there's not a strong understanding by the media or the end users of the purpose of that free chlorine maintenance. One is a conservation measure, and one to help reduce the flushing that occurs during the summer months by our cities that we serve. Next slide. So as I've already mentioned, summer flushing in Texas is a very common practice due to, as Bill mentioned, the aging water within the system, especially during our drought restrictions, as well as the high temperatures. So the temperature of the water increases, that chlorine residual will dissipate out of the water solution. Many of our cities, when they flush, they have to be very selective of the time period of when they flush, and then their communication to the consumers, the citizens, so that they understand the reasons why they're flushing. And we do get a lot of backlash because they simply don't understand that practice. What they are familiar with is they've been under watering restrictions for their landscapes for, for over 3-4 years now. And why is the city flushing and letting all of that water come out of the fire hydrants? Some of the comments that I've mentioned on the slides is, can't the cities do something else with that water? Consumers can't quantify the amount of water that the cities are flushing. Suggestions have been made, why can't they, put that water in tanker trucks and then water their landscapes? Some of our cities have had to flush upwards of 60 million gallons of water a day to maintain that chlorine residual, and it's simply impossible to have that many trucks available to have another means to dispose of that water. And why is this something that the city is doing? We haven't heard about this practice. We don't understand why they're doing that. While we can't water our landscapes during this drought, why is the city taking this action? So we've learned a lot about what we need to do to communicate better with our cities and those that the cities serve. Next slide. This gives you an example of some of the issues that we were faced with. We had lower reduction within our service area. We were wanting a 10% reduction this summer. Many of our communities saved that 10% and upwards of an additional 20%, so we were saving up to 30%. We were really having wintertime usage during the summer. So to help with moving that aging water through the system, the media picked up that if Plano was giving an extra watering day to help move that water through the system so that the citizens could use it on their landscapes, it was called a watering holiday. And it really wasn't targeting in the news or resonating in the media that the practice was being done for water quality and to ensure water quality in our distribution system. Next slide. Just another example, when we moved through in the media some articles, we moved through the summer. We had great participation from all of our cities. Again, we had upwards of 20 to 30% reduction. We really made it through the summer, ensuring that we could extend our water supply. So in September, when the weather starts to cool off, we did revert back to a once-per-week watering schedule to help move some of that aging water through our distribution system and to help reduce the amount of water that was being flushed in the cities that we serve. And so that parameter for once-per-week watering to help move that water through the system will actually end at the end of this month. Next slide. This chart just gives you some of our water use data in regards to years at the top. It is calculated in gallons per capita per day, the way that it's currently calculated in the state of Texas, which is all of your water that is delivered to a community is divided by that population, and that gives you your gallons per capita per day. It is not segregated out by user groups at this time. But as you read through the chart, it gives you your annual average gallons per capita per day for each year, summer average June through August, and then a summer average June through September, and what the peak day demands have been in regards to gallons per capita per day. And you can see that our outdoor watering made tremendous reductions. The outdoor watering restrictions made tremendous reductions in the amount of water we were having to deliver to our communities. In 2010, if you look at the peak day demands with no restrictions in place of 370, scroll through the years down to 2014 when we were actually watering once every other week, you can see we had a very large reduction in the amount of water that we were delivering to our cities. But then again, that also can be coupled with ensuring you have that chlorine residual and that water is not aging within your distribution system. Next slide. So what are the steps that the district has been taking? Again, we do the annual free chlorine maintenance. We have increased the chlorine residual leaving our water treatment plant. We have to be very mindful of the cities that are closer in. Right now we have around a 4 milligram per liter leaving the plant. And so we've increased as safely as we can the chlorine residual to not have effects on the more closer cities around us. We also have hired consultants to take a look at and evaluate our current treatment processes. Is there anything new, anything different we can change to help maintain that chlorine residual in our distribution system? We also hired a consultant to look at our distribution system. What's going on out within our pipes? Is there anything that we can improve to help that situation for maintaining water quality and that chlorine residual? We're now taking a look at and determining with the cities that we serve, is there a desire for those cities to actually add chlorine injection into their distribution system? There is some reluctance for that because the water district is viewed as the water provider and the expert in treating water, and that we should take the lead role in maintaining that chlorine residual. But we work very closely with our cities and communicate with them on how to actually tackle this problem as we move through the drought and we have reductions of water being distributed in our system, and though maintaining water quality. So next slide. So what are the lessons that we've learned? Well, one, we need to communicate more to our end users through the media, through our residents, our business owners, that the practice that we do for free chlorine maintenance helps and benefits water quality during the hot summer months. Summer flushing is a standard practice through our summer months. With our water use reductions that we've seen from our drought measures, an increase of flushing has had to occur due to the great reductions we've seen because our consumers have heeded the warning of we need to conserve our supplies. And we need to work more closely with our media so they get a better understanding of water treatment, water quality, and water protection. In that when individual cities are giving an extra day for watering, it's not to be viewed as a holiday. It's viewed as a measure to ensure water quality for the water that's served in the service area. Next slide. So in closing, you know, if you have any questions, send them in. And I guess this is actually, I guess, where you pick up, Marianne.
Yes, thank you, Denise. Thank you very much for your presentation. And we're at the point now where we're ready for questions from the webinar attendees. Thank you for hanging with us and being part of this discussion. So we'll get to your questions in just a moment, but I'll just do a few announcements. A PDF of this presentation, as well as the recording of the webinar, will be posted online at the Alliance for Water Efficiency's website at this URL, which is our webinars page. And we will, as Dr. McCoy indicated in his presentation, we will be providing more detailed information on the HACCP program in a subsequent webinar, because we do believe that as we design our commercial facility efficiency programs, we need to be doing them in concert with the safety side and the water quality concerns. So it's building that partnership that we talked about during the webinar. So we'll be providing more information on that. But we do have a regular webinar series, as many of you know, and our next webinar on November 18th is actually announcing a new series that we're making available for our business members of the Alliance for Water Efficiency to discuss their products and programs in a very direct way with members. And in this particular webinar, we'll talk about the topic of merging science and technology to instill a conservation ethic and to involve customers in innovative education strategies. So we will have more information on that webinar coming out shortly. But at this point, I'd like to turn it over to Jeffrey, our webmaster, and have him read us what questions may have come in during the webinar.
Hi, Marianne. Thanks very much. Appreciate that. We actually do have a few questions. They started rolling in right after Bill concluded his talk, so that's kind of the time frame of where they came in, just if that helps at all. But the first question being, is it true that only 5% of the population can get Legionnaire's disease? The rest just get a flu-like symptom called Pontiac fever.
Yeah, thank you for that question, and also for all of you who are sticking with us and participating in this webinar. I've never heard that statistic. I don't know. I've never seen that written. It sounds like it might be alluding to the fact that the non-pneumonia form of legionellosis, which is a flu-like kind of symptoms, is much more often transmitted. It's easier to acquire that infection from a building water system and it not go all the way to pneumonia. So remember, it's that the symptoms are kind of on a spectrum. You know, when a person is infected with the Legionella bacterium, if that person is healthy and has a robust immune system, then that infection may never make it to pneumonia. It's still legionellosis. Legionellosis is being infected with the bacteria, but a healthy individual might not ever succumb to pneumonia because their body was able to fight the infection. On the other hand, an elderly person, a smoker, someone who's already immunocompromised, already ill, that person infected with the same bacterium in the same way, now those symptoms progress from what you call Pontiac fever or flu-like symptoms all the way to pneumonia, which is, of course, much more serious. Back to you.
Wonderful. Thanks, Bill. The next is a comment followed by a question. This is an excellent presentation. Thank you so much for bringing more science into our water efficiency discussions. Question is, how do we deal with the California Energy Commission working toward further reductions in water use, for instance, faucet flows, but doing so without giving attention to this particular topic of health and safety in Legionella?
Well, I'll take a quick shot at that, Marianne, and Denise, you might want to comment too. I would say the first thing, and one of the most important things you can do, is participate in these kind of webinars and these kind of bridging the gap opportunities to meet people who are committed to smart water management. Because reducing the water consumption in a fixture is a great thing. It's a noble goal, but we have to do it safely, or we defeat the purpose. Marianne, I'm sure you have some thoughts too.
Yeah, we're very interested in how far standards can go in reducing flows from fixtures like faucets, particularly where they're in dead-end areas and buildings. And the California Energy Commission standards that are likely going to be proposed within a few months are going to be addressing issues that we think need some additional discussion and research. So this is one of the reasons why we wanted to bring this webinar and these issues out to the water conservation community, because we hadn't made this part of our research up to date. We had only really been focusing on whether the product would perform and whether the efficiency could be reliably and affordably achieved. We never thought about the other ancillary issue of water quality. So there, as Bill's pointed out, we can deal with it, we can manage it, but we need to have a good understanding of it. And so I think the Alliance for Water Efficiency's comments, which you can also see on our website, our suggestions to the Energy Commission is that they take a close look at this and make sure that they take this issue into account in setting their standards.
Wonderful. Thank you. Next question is for Denise specifically. Could you please clarify again how you addressed public backlash to the sites of flushing while watering restrictions were in place?
We had to really stress and communicate with our media contacts through the interviews for either TV, radio, or in print, that the flushing was to ensure water quality. First and foremost, the district and the cities that we serve must maintain water quality to keep the water healthful for our consumers to use. And then we had to then go back and look at, within our distribution system, our treatment process in the cities, what are the best management practices that we can initiate and evaluate for implementation while we are seeing these tremendous reductions in water to our cities and maintaining safe water. So we had to stress water quality was the first parameter, and the extra day was being given to help move the aging water through the system. But at the end of the day, the reporters and the news writers are the ones who actually craft the article to fit their need, and sometimes the water quality got lost in the message.
Thank you. Another question for you, Denise, is were the majority of the chlorine residual problems associated with dead-end lines, or were looped areas also impacted?
I'm not sure I can address that answer since it's actually within the cities we serve where the chlorine residuals were declining. My understanding that some of those were at the farthest areas within a city for the distribution of the water supply. I'm not familiar if some of those were in loop systems. I'm sorry, I don't know how to answer that since I'm not familiar with their own internal distribution system of water.
Okay, thank you. Just a general question. Have there been any studies conducted to show a direct correlation between low flow rates in plumbing fixtures, fittings, and disease outbreaks?
Well, I will just start by saying that Dr. Mark Edwards of Virginia Tech has been retained by the Water Research Foundation to investigate this issue, and he has given some presentations around the country on the research work that they're doing at Virginia Tech. And we in the water conservation community become alarmed when we hear Dr. Edwards speak, because he seems to be blaming water efficiency for these outbreaks, because he sees them in areas where there are very efficient fixtures and very efficient building systems. So that's what's propelling us to talk to you about measures and programs to overcome these disease outbreaks. I think Dr. Edwards' research that he's doing for the Water Research Foundation isn't completed yet, but I think that's what he's been assigned to do by the foundation, is to come up with correlations between what he's finding in the buildings and the root causes of those outbreaks. We are seeing them in lead buildings. You know, Dr. McCoy gave a good example of one that he's working on in particular. It's not an isolated event, but it may be because some of those buildings may have dead-end systems and lines. It may be for a whole series of reasons, not just water efficiency you know, standards in the fixtures. So there was a Johns Hopkins study, and maybe Bill, you might want to talk about that a little. There was a Johns Hopkins study that talked about the fact that they found Legionella in faucets in hospitals that had efficient fixtures installed there. And the concern that we had when we first saw the study was that it didn't seem to us that they had done the proper background analysis of, well, gosh, what was there even before the efficient fixtures were installed? Was this a problem in the system anyway? And so these are all questions that need to be raised when we see a lot of these incidents. And the Johns Hopkins study in particular rang a big bell on the issue of epidemiology and the concerns about finding these pathogens in efficient fixtures.
Thanks, Marianne. Question directed at Bill. Do you have any examples of how end users who are monitoring chlorine in real time are working with water suppliers or municipalities?
Yes, many examples. Let's see. The Mayo paper that I cited during the talk does discuss some of the interactions between the facility management and the municipality, so that would be one. But it's almost a daily occurrence. Like, for example, I'm working with a facility management team in a southern state, and they felt that the residuals reaching the meter were not high enough, so they called the municipality. There was a great discussion and great cooperation, and an increase in residual was provided. Now, there's not a guarantee that that's always going to happen, but I mean, I'm sure Denise would agree that there's a great motive for facility managers, especially of complex buildings like hospitals, to inquire with the municipality if there's a concern about the residuals, and sometimes specific things can be done to remedy that. You know, I forgot to mention one thing when I was giving the talk. You know, when the water, probably most people on the webinar realize this, but there may be some who don't. When the water crosses the meter and you purchase the water, it comes into your facility, it's no longer, it's your property at that point. The facility management and the owner of the facility are now the owners of that water. And so the processing that occurs post-meter is, you know, it's the responsibility of the facility management team to make sure that the processing that occurs does not degrade the water. It's not the municipality at that point.
Okay, wonderful. Thank you. There's a comment on the Johns Hopkins study that you mentioned. They say the Johns Hopkins study focused only on electric sensor-activated faucets. It is important to note that these faucets were the problem, not the manual faucets. It really wasn't about efficient versus non-efficient faucets.
Wow, that's interesting. Yeah.
Okay. So after that, more of a general question here is, what other venues, entities, activities are ongoing, and how or what can water agencies leverage existing and future public outreach and messaging efforts to adequately address the quantity versus quality issue?
Well, I would certainly.
Again?
Oh, go ahead, Denise.
I was going to say, can you repeat the question again? I'm not sure.
Sorry, yeah. What or how can water agencies leverage existing or future public outreach efforts to adequately address the quality versus quantity issue?
The quality, or I mean the quantity of the water being flushed, I'm guessing is what they're referencing.
Well, the water quantity, water conservation versus water quality.
Right.
The media messages that you were facing when you were doing your flushing program, I think is what the question is getting at.
Right. It goes back to stressing that even though we are in drought conditions and we have water restrictions in place, water quality still has to be maintained. And as Bill mentioned, it could be the aging infrastructure, or one of the questions that was asked me, which I wasn't able, is it a loop system, a dead-end system? Everything has to be evaluated, and tests have to be performed by the district for water to ensure water quality to our distribution point to the cities, and the cities then have to ensure water quality as well. Even though we're having drought restrictions and reducing our outdoor watering, that is a discretional use of water, and we have to maintain water quality for those non-discretional purposes for our hospitals and for us to use for health and sanitation.
So in the long run, the customer is probably not going to be totally happy with that answer, because they're still seeing that they're being restricted in their own private use while millions of gallons are being flushed down the street and from a hydrant. So there's a concern about how we should message this properly, and it's something that we're committed to working on here at the Alliance for Water Efficiency, because we think that part of the solution in the message is to manage the chlorine residual to the point where those kinds of system flushings are as minimized as possible. So that's one step. And the second step is to manage perhaps disinfection at point of use, so that even if the quality is lower crossing the customer meter, there's a solution to deal with it that doesn't compromise efficiency and safety at the same time. It's a tricky problem that we hadn't thought about a lot before, and I think we need to think about it a lot more now. So we are committed to bringing more on this topic to you over the course of the next several months, and to making sure that we understand how buildings use water and how water utilities manage water, and what the intersection is between those two. I want to go back also to the comment that was typed in about the Johns Hopkins study. The Johns Hopkins study may have been featuring more the sensor faucets rather than the manual faucets, but that's not how the promotion of that study came out. It came out saying efficient water fixtures are causing Legionella in hospitals, beware. And so this is a messaging problem. This is exactly getting at the question that was raised here. We tend to talk about results in ways that lead the media to draw their own conclusions, and they are not always correct conclusions, and they lead customers into an area of misunderstanding that's very uncomfortable for us as folks who work with them on a regular basis. So this is something we'll spend some time thinking about, and we wanted to have Denise as part of this webinar because she was right on the front line with this messaging problem, and we thought having you hear from her would be really instructive. But we'll find more examples, and we'll talk more about this as we go forward. So I see, Jeffrey, we don't have any further questions?
No. Okay.
Well, I want to thank all of you for being part of this webinar. I want to especially thank Dr. McCoy and Denise Hickey from both Phygenics and the North Texas Municipal Water District for volunteering their time today to bring us these issues and to talk with us. And look for more information coming from us on this topic, and we're very happy you joined us today. Thank you very much.